Yes, welcome again to the session of today. Today we are dealing with hypertensive disorders in mental health. Hypertensive disorders. Hypertensive disorders. Hypertensive disorders. Now, let's define what is hypertension first, then we can go to the topic of the day. Hypertension. What do you understand by the term hypertension? Let's see what you understand by the term hypertension. I think there are some values I think we will need to put down. Get a paper. Uh, yeah, hypertensive disorders. Hypertension is a condition whereby blood pressure in arteries is consistently elevated. The blood pressure in the arteries is consistently elevated above normal levels. It is often called the silent killer because it typically has no symptom but can lead to serious health problems. But the main thing here you should understand is one, hypertension is blood pressure elevated in the arteries. Blood pressure in the arteries is consistently elevated above normal. It is often called the silent killer. Now, there are normal values when it comes when you go to a doctor's office and you are diagnosed with hypertension. There are some normal values that a person should have normal values that a person should have, and they are the elevated values. Mm. So the normal values for hypertension is the normal is the systolic hypertension, the one that you see doctors writing up. It's called systolic, supposed to be at least less than 120 for a normal person. A normal person whose the body is working okay. And see, the diastolic one, which is the below one, the one that doctors write below, is supposed to be less than 8. At times it depends with the country, but when you go to other countries, it goes up to 85 and it's considered normal. So there is an elevated one, which is 120. You see, you cannot have a normal blood pressure that is consistent with let's say 120. You are always having 120 of over 1 over 80. The blood pressure of a person varies according to temperature, environment, issues that this person is undergoing, social issues. You get it? So it varies from time to time, and at times it may be above the usual one that you have, but it's still low. So we consider an elevated blood pressure between 120 to 130. Above 130 or 140, that can be elevated. That is for systolic, above 1. And the below is at least 80 to 85. Hmm? So when we consider you hypertensive stage 1, hmm, let me write them down, at least I can show someone. Normal, normal. I've said normal is less than 120, which is systolic. And then diastolic is less than 8. Then we have elevated. When it's elevated, when you are having stress, you have done several things, you have gone up and up. You see, this is the normal. Talking of the normal, systolic is above, diastolic less than. So if it is less than 120 and less than 80, we are okay. That is okay. But let's see when it is elevated. Elevated, it's supposed to be 120 to 129 and 20 to 129. The diastolic one is supposed to be less than 8. Then there is hypertension stage 1. Stage 1. We are going, this is the elevated one. When it's elevated, but there is hypertension stage 1. Stage 1, which is 130 to 139. The systolic blood pressure is supposed to be 130 to 139 and 80 to 89. So I've said hypertension is not a constant. No, your pressures are not constant. They can vary, but within the normal ranges. But yes, Mary, I'm in the house. I love Jamaica. Mary Butler, welcome to the platform. Today we are talking about hypertension, and how hypertension comes, so that people cannot be confused about hypertension. So when it is elevated, the systolic one, I'll put this up. The systolic one, this is the systolic hypertension. The above one is supposed to be 120 to 129. It's elevated. But when it is less than 80, less than, board arrow, this board arrow shows less than 80, the down one, you are still okay, but a bit elevated. And then we have hypertension stage 1, 130 to 139. And it goes between 130 to 131, you consider yourself, you have started being hypertensive. And then 80 to 89, you have started being hypertensive, the diastolic one. And then we have I will put them down, and I'll put this table up so that people can follow it up. We got stage 2, which is more when your blood pressure goes above stage 140, 140, and the below one is above 90. That is stage 2 hypertension. Hypertensive crisis is when your blood pressure at times goes, the systolic one goes to 180 and the below one goes to 120. You get it? But we have types of hypertension. We have types of hypertension. We have types of hypertension. We have primary hypertension. We have secondary hypertension. And then we have another type of hypertension, which is non-modifiable. Now, what differentiates this from the others? You see, with the primary hypertension, it has no identifiable cause. Your blood pressures are always high, without cause, maybe genetic. It is linked to genetic, lifestyle, or environmental factors, because a person in the high altitude will have different hyper pressure with the person who is at the low altitude. And then we have secondary hypertension, which has a known cause. A known cause like kidney disease, endocrine disorders, medication, less common. You see, sometimes this one comes with disease, and when it is treated, the pressures go down. Now, what are the risk factors of a person getting hypertension? Risk factors of a person getting hypertension. The risk factors of a person getting hypertension is high salt intake, high body weight, obesity, high body weight. Someone can be hypertensive with high body weight. Then we have physical activity. Those people that go work out in the gym so hard, or they go and work like digging a farm with a djembe for so long, or working in a factory carrying heavy loads. That one can be a purpose for your hypertension. Now, there is a linked cause of smoking. I'll explain how smoking causes hypertension, and excessive alcohol consumption, how it causes hypertension. We have stress, and that one is what we will link to today, to know how stress can cause hypertension. So that when you have someone who is being stressed with something, you know how to help this person when he's stressed. Unhealthy diet can cause hypertension. You know, when you're taking a lot of carbs and then you have a lot of cholesterol, you'll be hypertensive. Hypertension, we have seen, is we have seen it is a this is a blood pressure in the arteries is consistently elevated. So let me explain. I will explain that so slowly so that someone can know what we mean. Because this is how pressure in your body works. Your heart pumps blood, and if your heart pumps blood, there is the pressure that is exerted on the veins. Like this, let me draw. Oh yeah, let me draw this so that someone can, a layman who is watching, can understand this. Yeah? It is very important to understand things steps by step. Now, this is your heart, then there is the outer coming out like this. Then you have your veins like this. Now, this is what I'm considering. Eh? This is what I'm. Thanks again. Oh, thanks, very Butler. I'm explaining about the heart today, and in a very lay language. Lay language. Yes, just a minute. I draw. Now, this is your heart. This is your heart and your veins. You see how your veins are? They go and divide like this. Doreen Small, welcome to the platform. Today we are talking about hypertension. Hypertension. Now, I consider this as your heart. This is your heart. Now, this heart, the heart is the pump of your body. Heart. This is the heart, it's the pump of your body. You look at it clearly, that is the heart. But now these are the veins and the arteries. These veins and arteries are elastic. Elasticity means they can expand and relax. You get it? Expand and relax. So when they are expanding, when the heart is beating so hard, and there is pressure that is exerted on the walls of these veins in your system, on the walls of these veins, the pressure that is exerted, that is what we call blood pressure. Hmm? That is what we call blood pressure. So if the heart pumps hard and the blood pressure goes high, what can happen? What can happen? These blood vessels can rupture if it goes so high, and it may destroy. Like, let me draw something again. It's very important to understand what blood pressure is so that you can know how to manage. Now, let's see this. Now, this one is a structural form of veins and the heart. Veins and the heart. So if the heart is pumping blood so hard and faster, it's pumping so hard. Majay, hello, welcome. We're talking about hypertension. It is pumping so hard with high pressure. What will happen? This is let me, I've drawn the kidney here. Kidney. This is the kidney down there. The kidney will not filter blood well because it will be under high pressures, and even the valves inside the kidney may rupture. So blood pressure is the pressure exerted in these blood vessels in here by the pushing of the blood, the pushing of the blood. So we have talked about the normal blood pressure, the systolic one. I repeat, look at that. Look at that clearly. This one is the normal blood pressure, 120 over 80. 120 over 80. Now, the systolic one is which you see doctors writing like the normal. Let me write it again so that we may not be. confuse the systolic one, 120/8. Now, systolic is the above one, and 80 is the downward. You get it? Now, that is normal blood pressure. The pressure that the heart can pump, can give the arteries, and it's normal. Your body is functioning well. Your kidneys are okay, filtering blood okay. Your pancreas is working nicely. Your liver is working nicely because the pressures that are being exerted are normal. You get it? So when you go above 120/80, something starts to happen because when you work hard or do some things that are considered heavy in your body, it will go up 120/80. You see that 120 to 129/80. It means the body is compensating. You are working and the body is compensating. But when you go and relax, the pressures go back to normal. You get it? Go back, it is elevated, but you are okay. But now, when it goes to 130/139, what happens? We start saying you need drugs, you are in a crisis. Now, what can make someone to please share the video? We want to help people because this is a very complicated story and people are confused about it. That's why I'm moving so slow today for us to understand. Like and share. Okay, we continue now. I'll be very slow today, but if you have any question, put it on the platform. Yes, Marcia, welcome to the platform. Today we are talking about hypertension, and even hypertension related to stress disorders. How stress can lead to hypertension. That's I've explained how hypertension is and what is hypertension, and the mechanism of which the heart pushes the pressures to your blood vessels. So we continue. We are introducing the topic today. I'll be very slow, and don't fail to ask a question even if you've come late. I want everyone to understand wherever you are. Now, we have said primary hypertension, there is no identifiable cause. Maybe it is linked to genetic. People are born in that family with hypertensive disorders. And then there is secondary hypertension, has known cause, either kidney disease, endocrine disorders. When we talk about endocrine disorders, we are talking about things that are related to hormones. Hormones can make you have high pressure. We will see how. Medication, you have been taking steroids, and steroids increase adrenaline in your body. You know your body produces a kind of steroid. Your body itself, it releases a steroid called cortisol. So if you add another steroid, it releases more adrenaline, and then you start having high pressures. Now, what can make you have these problems of high pressures? We have said high salt intake, obesity, physical activity, smoking. I'll explain why smoking, excessive alcohol consumption, stress. Stress is what we will die on today so much because we're talking about mental health and hypertension. Unhealthy diet that gives you carbs, high cholesterol, and in your system, the blood becomes thick and pressures become high. Okay, there are some things that you cannot modify when it comes to hypertension. When it is family history of hypertension, what you can do is to manage the pressure not to exceed the limit so that the pipes can burst. You understand? Family history, when you have family history of hypertension. And then there is age. People that are above 55 years, well, at times their hypertension is only managing, you cannot control it. You cannot treat it. You will see which hypertension you can treat and which one you can manage. Male genders are always prone to hypertension. Male male genders. If you look at the research that is being done, you will find that male genders are prone to hypertension. And then African ancestry. The most investigation link hypertension to African ancestry. Now, there are some things you can look at and say that there is a problem here. I'm not being okay. Remember, we are just having an overview. There are some things you need to know and see and look at and know, I need to see a doctor. This can be a sign of hypertension. What are these signs? Severe cases may show this. Headaches, sometimes when you are nose bleeding. And why nose bleeding? I've said when the heart is pumping hard, some blood will tend to, let me get a syringe here. Now, this is a syringe. This is a syringe. We consider this syringe as one of the blood vessels. I've drawn a structure here with the heart. Now, consider this blood vessel, this syringe, this one. This blood vessel, consider it being this syringe. You get it? If you consider that being this syringe, what will happen? When the heart is pumping blood, pumping, so this is pumping blood, and the blood goes above the normal pressures. The tension around these blood vessels cannot hold blood again. It will find a route, and those roots may be on the blood. It will rupture. Hmm? And why nose bleeding? Because around the nose, there are some capillaries that are weak. That's why people nose bleed around here when the pressures are high. So the high pressure push links to nose bleeding because rupture of the capillaries. And then blood vision. Remember, your eyes have some capillaries. There is something called cupping behind your eye. When it's put under pressure, the normal oval shape behind your eye becomes bigger because now the liquid that is within your eye is being pushed and it is opening wide. So when you have cupping, one, you'll have blood vision. Then chest pain related issues. I'm saying symptoms that you may look at a person and know there is a problem here, I need to see a doctor. Chest pain, central chest pain, we call it angina in medicine, angina. This is because of the heart. The pumping and hard pressures in the heart causes it to pump so fast and it starts to be tired. So the ventricles make you to have to feel the chest pain and then shortness of breath. High pumping power is related to shortness of breath, and then you get dizziness now because now your pressures are high, your, your brain is receiving high pressures, you receive complications like dizziness. And there are some other complications that you may receive like stroke, heart failure, because when it is tired of pumping, what will happen? Heart failures will happen. Myocardial infarction. Myocardial infarction is heart attack. Hmm? You get it? It causes heart attack because of even the heart itself needs oxygen. But when it is pumping so hard that it's not getting enough nutrients and oxygen, what happens? Stops working. Heart attack. Kidney failures. Why kidney failure? Because high pressures destroys the nephrons. In the kidney, there are some pipes. I'll draw the structure and I'll show you. When they are under high pressure, they can burst. And then they will not filter blood well. So what will happen? You will start having proteins that are going to your urine and you will not have normal pressures again. We call it proteinuria. And then aneurysm, veins that are dilated in your body, they are not working well. Retinopathy, damage to your eye, those are the complications. Now, let's go to the pathophysiology. Now, what causes the pressure itself. Please remember to like and we continue. But don't fail to ask a question. Don't fail to ask a question because you are not understanding somewhere. It is very important that you ask a question. Even if you feel it's not important, that question can help someone. Now, the pathophysiology of hypertension involves very complex interaction among the heart, blood vessels, the kidney, hormones, nervous system that lead to elevated blood pressure. Hmm? You see, and we have said that it can be classified as primary and secondary. You get it? Hypertension can be primary or secondary. So normal blood pressure is determined by, I've explained how sometimes doctors may calculate what is coming out of your heart times the resistance of the vessels. You see, when blood is in your heart, what is coming out and the resistance of these vessels, it may determine your blood pressure. You get it? Now, what does, how does the mechanism of hypertension come in? How? I'll explain very slowly because most of them are medical terms. But if you don't understand, you just ask. But I'll be so well and slow in explanation. I want everyone to know the killer disease, hypertension, and how to manage it. Now, there are some key mechanisms that causes hypertension. One of the mechanism is increased sympathetic nervous system. I'll explain what is sympathetic nervous system. And then there is something else called renin, angiotensin, aldosterone system. I'll explain that, a system that helps your kidneys to this that helps your kidneys helps these blood vessels to constrict or to relax the kidneys. You get it? That is called renin angiotensin. I'll explain very slowly. I think today we will deal with mechanisms, and then tomorrow we'll deal with something pathophysiology today, how it happens, and then tomorrow, because hypertension is a broad spectrum, and I cannot only talk of hypertension only related to mental health. I want to cover everything in hypertension. And then we have talked about sympathetic nervous system, the renin angiotensin in the kidney, and then we renal mechanism and sodium retention. Sodium, we have said high intake of salt. That is the third one. Endothelial dysfunction. Endothelial dysfunction is endothelial dysfunction means the blood vessels that are not working. And then we have vascular remodeling, hypertension, hypertrophic and vascular muscle remodeling. And then we have insulin resistance and metabolic disorders. That's why most of the people that have diabetes, you will come and see that they are having hypertension. So where do we start? Because I want to explain very clearly the 6 pathophysiology of hypertension very clearly. And then I'll go to the other one, which is mental, which will be the last. Today we will deal with pathophysiology only, because I want everyone to understand, to get to know how hypertension comes. You get it? Even someone who will come and view this video afterwards will appreciate, because there are some people who are very confused. They don't know. Some people always say that I went to a doctor and the doctor told me that I'll take these drugs forever. No. If your hypertension is linked to a certain condition and we treat the condition, you may not continue with the medication. That is me saying, not the other doctor who told you that. And I want to explain that very slowly, because I've met so many people in my office and my places of work telling me the doctor told me I'll take these drugs forever. Now let's see who will take these drugs forever and the one who will not take these drugs forever. Now the first one, which is increased sympathetic nervous system activity. What do we call sympathetic nervous system? Sympathetic nervous system. Sympathetic nervous system. What do we understand by sympathetic nervous system? We have the system of your body. There are two. We have sympathetic and parasympathetic and automatic system. Now, sympathetic nervous system, very slow. This is the how this system can cause hypertension to come in. Remember, we have six parts. The sympathetic nervous system is part of the autonomic nervous system that you cannot control, that helps you to flight or fight. When someone has come with something that you want to injure you, you can run away or you can fight back. You get it? It's a system that tells you someone is in danger. You are in danger. Please run. You get it? In hypertension, chronic overreaction of the sympathetic nervous system. Now, this is how it it works. Sympathetic nervous system increases your contractility, the heart to contract, the heart to beat fast. And when it the heart beats fast, what happens to your vessels? They are not bigger anymore. They become small. They become small. They automatically come small. You get it? Why? So that they can send enough oxygen to your brain very faster for you to run away or to have energy to fight. Because if your brain don't get enough oxygen, you will not have the energy to think and fight back or run. You get it? And then there is something in your kidney that is called renin. The work of renin is one. The work of renin is to make these blood vessels constrict. You see, when your brain wants to get enough oxygen faster, Doreen, what if blood pressure is 111 over 87? Yes, Doreen, we have seen the systolic one. If you have a question, ask. We have seen the systolic. Let me take my chart again here. Your systolic one, the above one, the systolic, I'll explain very slowly. The systolic one, yours is 111. 111, and the diastolic is 87. So the above one is normal, but the one which is down is 87. What does that show us? There is a problem maybe with your heart, or you have something that is going on. You get it? Because the normal one should go up. They should correlate. If the above one has gone above the normal, the lower one should come above the normal. So this tells us Doreen is from Jamaica. Yes, Jamaica. Big up Jamaica. Yes, it shows us that the blood pressure of that person is related to some pathology, some problems. We will see how a blood pressure can be like that, which problems can come out like that. So systolic blood pressure is the top number of the blood pressure. I want you to understand what is systolic. It's the pressure in the arteries when the heart contracts. So when your heart contracts, the pressure that is measured in your arteries, when your heart contracts, the pressure that is measured in your here, when the heart has contracted, is what is the above, is what is the systolic, the one that is above. You get it? And then we have diastolic. We get to understand this very slowly, very slowly. And if you have a question like Doreen, just put it out. And I've told Doreen that shows there is a problem somewhere, either with your heart or your vessels. We will see how a blood pressure can be like that. Now, diastolic blood pressure is the bottom number, the bottom one. I've written something here, here, this one. The systolic, the red one here. You see this one? Systolic, diastolic. The diastolic is the one which is down, down. Now, this is the pressure when the heart is resting, because your heart cannot be pumping, coming without resting. So when it pumps, it reaches around, it relaxes, then it rests, then it relaxes, then it pumps. So we measure both. The most I'm going to take a pressure now and tell you. Hey, Marcia, don't be so curious about your BP. Let's learn, and then we know we know, because as we continue to learn, someone will understand himself better. Yes. So I've said, when the heart has constricted and has, take this hand of mine as the heart now. You see how this diagram is. This diagram related to this diagram, relate to this diagram. Now this is my heart. It has contracted, it has relaxed. So when it is contracting, we measure the blood pressure of your arteries. The arteries. We measure the blood pressure of your arteries, and we know it is the above one, 120. We know it is okay. When it comes and relaxes, because when it contracts, there is a way it will come and rest, then it relax. So when it is resting, it is the below one. It is the most important, because if the blood pressure when it's resting is high, it means when it will contract, some of your blood vessels will burst. You get it? That's why we really, when you go to a hospital and you find you have the low one, when your heart is resting, is where you have the problems with your vessels. So it means when we contract, it can burst. So we should be very careful with the lower one. You get it? Than when it is contracting. Okay, let's continue. I know everyone has understood the difference between diastolic and systolic. That is the simple explanation. So I was talking about the sympathetic nervous system, part of the automatic nervous system. The nervous system is a system that helps you to run things out. So it is automatic that when you see a lion, you will run away. This is a system that has told you, this is a lion and I cannot stand here. Let me run. You get it? Hmm? So when it is, these are things that happen at the sympathetic nervous system. Hmm? Doreen Small. Yes, Doreen. The low one is the trouble one because of this. I've said when your heart is, the upper one is when I've said, look at my heart like this. My hand, this is the heart. So when it is contracting, it is the above one. It means it is taking blood away from the heart to the vessels. You get it? And then it relaxes. It relaxes and rests. It's a very fast action that you cannot notice. So when it relaxes and rests, when it is resting is the lower one. So when it is resting is the lower one. Lady M, welcome. We are talking about hypertension. So when it is resting is the lower one. You get it? It means when it is resting and the blood vessels have high pressure, what will happen again when it will contract? It will add high pressures in your vessels and they may rupture. You getting ruptures in your vessels. So if we see the lower one when the heart is resting is high, it's an emergency. We really need to bring this hypertension down, these blood pressures of the vessels down, so that when it will contract, you don't rupture your vessels. You understand? Yes. Now we are in the mechanism how hypertension comes. We have said in the sympathetic nervous system. Sympathetic nervous system, we have said it, we have talked about it. It's the part of automatic nervous system that helps you to do things in a rush. I just tested, first is 82 and then 78, the bottom one. Yes, Doreen Small. For me, that one is okay. 120 over 73. Marcia, clap for yourself. That's a very normal pressure. Now, don't be worried. Look at our chart. Look at our chart. Look at our chart. There is something I want to say. It depends also with your body weight and some other factors. So I've said Doreen Small has said 82/78. For me as a doctor, it is normal, but Doreen should be taking more fluids. I'll explain. Let's learn about this. Then, Doreen, I'll explain to you how and why I'm saying this is a normal pressure. You understand? Like and share to help someone. Like the video and share, please, as we continue. Now, we are continuing with our topic. Age, yes, Doreen, age differs. I've said it. Age differs. Age differs a lot. Now, we continue at, we were talking about sympathetic nervous system. And then we got tangled in that. But it's okay. It's good to explain and say, now, it's part of the autonomic nervous system. So when you have flight release hormone, which is adrenaline in your system. Kish Kish in the platform. Greetings, Kish Kish. We are talking about hypertension. Welcome again. Now, increased sympathetic nervous system overreacting. The CNS leads to adrenaline now is in your system. The heart rate will increase in contractility. 2. Vasoconstriction. Your vessel, your blood vessels, your blood vessels will constrict. These ones, the arteries and the veins. Why? Because they want to give your brain enough oxygen and nutrients to work overload. You get it? And then there is activation of renin, angiotensin, aldosterone system in your kidney. Now, let me explain about what happens to your kidney. If this topic will not end today, we will continue with it tomorrow because I want everyone to understand this very carefully. Renin angiotensin system. I want to explain what happens to your kidney so slowly so that you can know what to do when your pressures are high. And when you hear that someone has a pressure and it has destroyed the kidney, you will know what to do. Now, renin angiotensin aldosterone system is a system that plays a central role in blood pressure regulation, fluid balance, and electrolyte imbalance. You get it? To increase blood pressure and maintain blood volume when there is low blood pressure, because your body can sense when you have low blood pressure, and then it sometimes you can feel you are down. Maybe your pressures has gone down because of something, and then the body itself brings the pressures normal. Sometimes you can have low sodium in your body, and then the body regulates. Sometimes you can have dehydration because of diarrhea and other things, loss of fluids, and then your blood pressure goes down. Sometimes you can have decreased renal perfusion. Renal perfusion means the kidney has no enough fluids to pass through, I mean blood, so that it can. So this is what happens. There is something called renin. Renin is a hormone in your kidney. You get it? Renin. So what does renin do? What does renin do? Renin is a vasoconstrictor. When I say vaso, please remember I'm saying, vessel, blood vessels like arteries and veins. Arteries and veins. So our kidneys, this is just a model I've drawn to show our kidneys are down here. Let me draw it well. Our kidneys are down here. So you see, now there are some cells called in your kidney cells, juxtaglomerular cells, that release this hormone, and it plays a central role in blood pressure. So when your blood pressure goes down, this cell senses there is the normal pressure that is being exerted on us is not right. You see, your kidney senses this thing. I'm explaining how your kidney plays the role of blood pressure monitoring. So blood is being pumped by the heart, pumped by the heart, pumped. But in the kidney, the juxtaglomerular cells, these cells called juxtaglomerular cells, they sense that no, we are used to certain amount of pumping. The blood is used to, let me say, it pushes us. The blood pushes us like this, but today it is not pushing us hard. So what happens? It releases something called renin. Renin. So when renin is, you see, there are some things that they made Roger Killer in the house. So long, bro. I see you today. We are talking about hypertension. Welcome to the platform, bro. Now, you see, what can make renin to come out? These cells to sense, no, it's time to release this thing called renin from our kidney. What can make low blood pressure? Oh, Marcia, that is high. That is not even, that is hypertensive. Not even post, that is hypertensive. That is hypertensive. You see, it is above here. It is above our, everything is above our, even it's even higher than hypertension stage 1. That is over. That is over. Now, we continue. There are things that can make this renin to be released. And you see, I've said renin. What does renin do? It constricts the vessels here so that your brain can get. You see, when the pressure is low, you need to reduce the spaces in your artery so that the pumping can be okay and the brain can get enough oxygen. So renin does this when it is triggered by low blood pressure. The juxtaglomerular senses that the kind of pressure we are being used to is not normal, it releases. And then there is something called low sodium levels. You don't have enough sodium in your body. Sodium, salt, sodium. Because you remember when we were in primary, we used to put salt in a potato, then we add some water, we see where the water is moving. So when you have salt inside, sodium in your system, it pushes inside fluids so that you can have enough pressure. But when the fluids go away, the pressure remains unstable. So more fluids inside causes normal pressure or pressure that has gone high. But when it is less, salt, the sodium is philic. It loves water. You get it? It brings water inside. So when you have low sodium in the distal tubes of the kidney, what happens? Just a glomerular cells releases renin. Why does it release renin? So that these vessels can constrict to become small. We don't want big arteries, big veins with less blood. Your brain will not get enough oxygen and nutrients. But when you have constricted veins that are small with at least little blood fluid, it will go okay. You see, and I've given an example of this syringe. And you understand that, how it pushes. And then there is sympathetic nervous system. We have talked about the sympathetic nervous system and how automatically you sense there is danger, you want to run. Renin is released. It constricts your blood vessel to become small so that it can pump faster in your brain to get oxygen. Please, if you have any question, continue bringing your questions on the platform as I'm seeing, so that we can deal with them. And we have seen there is Marcia Thompson. Marcia Thompson has said someone had 155 over 92. As we continue, you will know why that person has had 155 over 192. So when renin is released, this renin, it converts another thing called angiotensin. It is produced from the liver, it is in blood, but it does not work, it just circulates. It's waiting to be reactivated. So renin converts angiotensinogen, that hormone that just works in blood. It just works in blood waiting to be, you get it, angiotensinogen to angiotensin 1. You see, it has started. It is a very fast mechanism that you cannot, you get it. Roger Killer, if you have ever gone to Thika Road, just after the university called Kenyatta University, there, just after that, watch our encounter with Jamaican uncle, you will see it. Watch that video, you will see it there. Now, Sawa Roger Killer, watch that encounter, you will see it there, just after Kenyatta University, up. Now we continue. Angiotensin converting enzyme. Then there is an enzyme called angiotensin converting enzyme. It is waiting for angiotensinogen to be converted to 1. Then the enzyme catches the angiotensin angiotensin 1 and it converts it to 2. Now 2 is the bad option. Angiotensin 2, which is converted by angiotensin 1, converted by angiotensin converting enzyme, is the bad thing, because it converts vasoconstriction. It makes the vessels constrict. Now the angiotensin 2, it makes your blood vessels constrict, stimulate aldosterone release, cortex, aldosterone, in your brain. And you know what aldosterone is? I call it water hormone. Water hormone. I'll tell you what it does. And then we had ADHD, vasopressin, antidiuretic hormone, to retain water in your body. So I stopped eating canned food, soda, exercise. I stopped eating canned food, sodas, and exercise 5 days a week jogging. Doreen Small, expound about it. We need to listen to that now. And it increases that thirst, because now it has retained water in your body, you see. And aldosterone, what has this do aldosterone do? Aldosterone, what does it do? You see, now we are talking about how your kidney works. Your kidney does very many things. Regulation of water in your body, creation of, it is related to even how your red blood cells are. When you are anemic, it can be linked to the kidney, because the kidney has something called erythropoietin, which makes the red, it's a hormone that comes in when it comes to creation of red blood cells. You get it? Now, we have talked about the renin, how renin angiotensin system. That is how blood pressure is contained. You get it? This is the most important when it comes to kidney failures, people that have kidney failure. And then aldosterone hormone is a steroid secreted by adrenal cortex in your brain, the zona glomerulus inner in your brain. It plays a crucial role in regulating blood pressure, sodium and potassium, increasing blood volume, because it retains water inside the blood vessels, raising blood pressure, maintains electrolytes. So when you are a lion has come. Your kidney, the cells we have called juxtaglomerular cells, senses, see, there is a problem. What happens? Releases the renin. Renin converts angiotensinogen, which is walking in your bloodstream, walking. It converts it to one. Then there is the enzyme, angiotensinogen converting enzyme. Come see, test the angiotensin 1. Hey, you should not be 1. You should convert yourself to 2. It converts it to 2. Then the angiotensin 2 does what? Constricts the vessels. It releases aldosterone, which retains water in your blood vessels so that the water cannot. You know, your blood vessels are not just, they are hollow. They can be hollow, porous, or they can come and shut so that no water can lose. So that is the work of aldosterone. It maintains it maintains sodium inside the blood vessels, so that the sodium can take more water, so that inside the blood vessels there can be more fluid, so that pumping can take oxygen so fast in your brain. You get it? That is the work of the kidney when it comes to management. But when you are relaxed, the fear has gone. Juxtaglomerular cell says yes, it is okay now, and what can we do? Sorry about that. It says now, what can we do? Hmm? Let me see. Someone has asked a question: is jelly water good to drink every day? Now, Marcia, what does jelly water contain? What does jelly water contain? That is the the question. I want to know, what does jelly water contain? I will find out and then I'll just answer you right now. Now, we have talked about the kidney, how it works, how it is activated. Hmm? We have seen about the aldosterone in your brain, the water retention molecule. Hmm? Renal mechanism and sodium retention. So that is how we have explained the Doreen Small. Oh, it's coconut water. Yes, coconut water is okay because it contains some nutrients. It's Karen White in the house. Karen White, we are talking about hypertension. We are talking about hypertension. Hmm? Now, we talk about how Karen White. Okay, welcome to the platform, Karen White. Now, um, foods that have nutrients like sodium, manganese, copper, those are very important. And you see, we say jelly is same as coconut water. Yes, and you see, let's see what coconut water has. Coconut. Yes, we are talking about coconut water. It's clear liquid found in young coconut. It has the carbohydrates, protein, fats, and fiber. Coconut water has carbohydrate, protein, fats, and fiber, which is okay for your body because of the nutrients that they have. Yes, yeah, Karen White, we are talking about hypertension. I've explained so many things that is very important to go through so that you can understand this topic so slowly. Now, we have talked about how the kidney retains, and then I've gone to talk about the other one, which is renal mechanism of sodium retention. You see how salt is retained in your inside your bloodstream so that more water can come in. If you take salt outside your bloodstream, the bloodstream, I mean the what is inside your blood vessels, inside your blood vessels. So when you take water out, salt out, water will follow that salt. So Aldosterone is a hormone that is released, and we have said it is released in your brain, adrenal cortex, the zona glomerulus here in your brain, so that it can go to the bloodstream, so that water can come inside the bloodstream. You see, that is aldosterone. Now we go and see the other one, hypertension today, endothelial dysfunction. Endothelial dysfunction. Endothelium produces endothelium. Endothelium is, you see these blood vessels, let me put it up. You see these blood vessels, inside there is a wall inside the blood vessels. Here inside the blood vessels, a wall which is called endothelium, aligning inside the arteries and the veins. It is called endothelium. So it releases some, the endotheliums, the cells in the endothelium may release nitric oxide, which is a vasodilator. Sometimes when it releases a lot, it makes now your vessels will not constrict, they'll be big. You see, and your pressures will go down. Because you have said one, your blood vessels, let me take another paper here, important to explain this. I've said your arteries and your veins, your arteries and your veins are porous. Hmm? Are porous. Let me see. Doreen, I work out, but I haven't not gym since my son is hoping to start back. Sorry, Carol White. Hope is going on well. Hope your son is doing well. Sorry about that. Okay, let me draw this. Now, let's relate with this one. This is your artery. So when the sodium is inside, the porous layers here goes, the sodium is here, water goes in, water goes in, water goes in. But when the sodium is outside, water goes up. So when aldosterone is released, the sodium that is in the pipe, in the arteries, brings water inside. You get it? And then inside that, the layer inside your blood vessels. I have never had a blood pressure before, but listening, I feel one was, and no, don't be worried. Today we are learning Roger Killer. Now, you see inside there is a layer called endothelium. Inside this artery or vein, there is, the inner one is called endothelium. So in the endothelium, when now you have relaxed and the flight, the lion has gone, no one now is, you are not in danger, it releases something called nitric oxide, which really relaxes the walls and they become big. Nitric oxide relaxes the wall and they become big. You get it? Now, that is how it happens. There is something called endothelin, endo, inside, thelin. The endothelin is a vasoconstrictor. So when there is flight and fright, what happens? Endothelin is released, renin is released, and the conversion goes on like that. The other thing is aldosterone in your brain is released, and sodium is retained, and water is retained. Now, that is how we regulate blood pressure in your body, about the kidney. And then there is the fifth one that I say is vascular remodeling and increased TPR, hypertrophic of vascular smooth muscles. Narrowed smooth muscles because of some things. We will see all those complications, why your vessels can be narrow. You get it? And then we have insulin resistance. The last one, insulin resistance. Insulin resistance and metabolic syndrome, common in obesity and type 2. It causes this. Those that are diabetic and they have insulin, we have talked about diabetes at a time. Diabetes is this. Diabetes is this. It's a common problem. Frank, I'll call you back kidogo. Hi. Diabetes is this. Diabetes is your body produces something called insulin, a hormone called insulin. So this insulin changes the glucose that you have in your system to something called glucagon, and it is so stored in your liver. But if the insulin which is produced from cells called beta cells is not enough, what will happen? What will happen if the insulin being produced is low? It will not convert the glucose, more glucose to glucagon to remain with the enough that is required in your system. And you see, glucose more than 11 milligrams per deciliter in your body is not okay. It is a bit high. So if it goes to 10, the insulin is released, it is converted to glucagon, it is stored in the liver. You see, very important. This is Roger Killer. Don't worry about it. Let's talk about it. I'll tell you why. And I know Roger Killer. Roger Killer is a hard worker. So him, we have said, uh, activities can make your blood pressure to go high, but when you are relaxed, it will go down, and you have seen how it goes down. So Roger Killer, don't worry about it. Do you have his Roger Killer? Do you have history of hypertension in your family? Have you ever been told in your family that you have the history of hypertension, Roger Killer? Please tell me. Now we have gone to those problems that come with diabetes. Insulin resistance. You are not giving out enough insulin, and your body maybe is obese, which is coming to diabetes types 2. It will cause increased sympathetic nervous activity. So you see, insulin resistance is related to sympathetic nervous activity, and you have seen what is sympathetic nervous activity. Flight or fight, release of epinephrine and adrenaline. Adrenaline increases. You have seen how we have gone about it. Yeah? Enhanced sodium reabsorption. So when you have this syndrome, you will have sodium reabsorption, getting a lot of sodium in your system. And you have seen a lot of sodium in your system attracts more fluid inside the blood vessels. So if more fluids goes to inside the blood vessels, your blood pressure rises. You get it? You have diabetes, but now you are having enhanced sodium retention in your system because of insulin resistance. So your blood vessel pressure goes high. And then endothelial dysfunction. Vasoendothelin is released. And what happens? It You are having a lot of fluid and your blood vessels are relaxed. Yes, very fine family. If you have a question, ask. Let's share this video. Let's interact. Let's like. Yeah? As we continue talking about these problems. Now, I've talked about how, if you have a question and you've not understood how hypertension comes, please ask. I've talked about of increased sympathetic nervous system, which increases your heart rate. It makes your blood vessels to constrict, and activation of renin, angiotensin, and aldosterone level, where renin converts angiotensinogen, which works around your body, to angiotensin 1, and then angiotensin converting enzyme is converted to angiotensin 2, and the angiotensin 2 does what? Constricts your blood vessels. We have talked about that, which is vasoconstrictor. And that angiotensin 2, it stimulates aldosterone in your, when it is converted to angiotensin 2. Aldosterone now comes out because aldosterone is the mother of retaining sodium inside your blood vessels and water. So your pressure will go high. So when a person is running, his pressures will go high. When a pressure is, if a person is angry, if a person is angry, your pressure will go high. Because of what? Because now you are hungry. That is fight. You are angry. And when you are angry, this explains why when a person is angry, there are some people, when they are so angry, their pressures go above normal. It's because of release of flight hormones. Flight hormones like aldosterone, adrenaline, and you have seen aldosterone retains what? Salt, and retains water in your body. So when you find out when you are angry, your pressures go high, you find out the way to calm yourself down. Because you know it may go high until you rupture your blood vessels. Now, this is the mechanisms that come in when people have problems with pressure. And then we have renal mechanism and sodium retention. Eh? The aldosterone, which retains salt inside. We have talked about it. Endothelial dysfunction inside the veins and the arteries, where there is a mode where vasodilating veins, you release nitric oxide, and endothelin, vasoconstrictor. So when you are having this problem, the vasoendothelin is released, you vasoconstrict. Okay, vascular remodeling. We will talk about vascular remodeling in high cholesterols and atherosclerosis, veins that have worked up and then they reach a time they cannot relax and constrict anymore. And then we have just talked about insulin resistance. Insulin resistance, when you have a problem of releasing insulin, or you are obese, big body, and you are told you are diabetic, and then you start having hypertension, this is what happens. If you notice that many people that are lead to heart problems, strokes, etc. Oh yes, Karen White, strokes, because we will talk about stroke. It's a sister to high blood pressure. We will talk about it. You see, stroke, I will say it faster. Stroke is your brain not getting enough oxygen and nutrients. That is stroke. And then you cannot function anymore well. And if it is taken, if it is short, we call it transient ischemic attack, but it is reversible. But it is chronic. When it is chronic and your brain has gone to an infarct, and infarct is a dead part, it is called now stroke. This is where you go to an ICU. But if it is a thing that has come, the medical emergency team has taken care of it, and then you are okay, we call it transient ischemic attack, and you can be good. Now we continue about it. If you have a question about hypertension, how I have explained how you can get hypertension. Things that are related where you can get hypertension. And we have said hypertension can be primary or secondary. Now, primary is whereby whatever that is bringing this high blood pressure is unknown. But secondary is whereby whatever that is bringing this hypertension is known, diagnosed by the doctors and known. Like what? Someone having problems with insulin production, being diabetic, and then you end up having vasoconstrictions because of insulin resistance. You get it? Now, in mental health here, how stress can cause hypertension. We need to understand how stress. I've at least explained how your body balances blood pressure. And I've said clearly that this thing that I've written here This thing that I've written here, these are the normal values and hypertension. Where I've written elevated, it means that you have been working and your pressures have been elevated a bit, but at some time they'll come to be stable. Your pressures are not always 120/80. It depends with the kind of activity you are doing and the altitude. You get it? But even if it is altitude, they are not supposed to go above the values that I've written here. So, you know, some people can get stressed. Hmm? In primary hypertension, there are some people that have problem with their veins. Some factors like the nitric oxide, which is a vasorelaxer, cannot be released. And then you find genetically these people have problems with high, the pressures are high. And we cannot let them be like that. We have to contain them because there are some vessels in the brain that can rupture. And then we have some other people that these people, they have lived a sedentary lifestyle. They have taken a lot of carbs. They lack a lot of sugars. They live, and you see a lot of sugar in your body when you take carbohydrates. A lot of carbohydrates, sugars, and ice creams, and what they are being converted again into some cholesterol. If you take a lot of carbohydrates, they get converted into glucose. Then the glucose itself, it get converted by insulin to glycogen, no, no, to glucagon, which is stored in your liver. I will need to visit a hospital soon for more checking. Yes, it's good to visit a hospital just for normal checkups. It's not necessary that you are sick. Now, the glucagon, when you have not eaten, it converts a little glucagon from your liver to glucose so that the cells of your body can get energy and you continue working. You see that? So when you one day you stayed the whole day, you have not eaten and you have worked the whole day and you are okay, you will know that you have more glucagon. Benjamin, I don't have, but last year I went to doctor for small procedure, then it was high. My fright caused it. Karen White, yes. Now you've started understanding. You went and looked at the doctor, and adrenaline was released, and then adrenaline, the flight mode, released renin in your kidney, and then renin did what? Converted angiotensinogen to angiotensin 1. Then angiotensin 1 was converted to angiotensin converting enzyme to angiotensin 2. So what did angiotensin do to you that day, Karen White? It constricted your vessels and it released aldosterone in your brain. So when it released aldosterone told your body, please put more salt in the blood vessels so that we can retain more water. And then your blood pressure went up. That is the only mechanism. But when you are out of there, endothelin and nitric oxide came in, juxtaglomerular cells came in. They stopped the renin to come out and nitric oxide was released. So your pressures came on okay. That is the normal balance of life. You don't say that today I went to a doctor, I think my pressures are high, I'm hypertensive. No, it is wrong when you go to a doctor, one reading, and then they declare you hypertensive. You should be checked like at least 5 days consecutively or a week consecutively so that you can be known now you are hypertensive. But when it is too high, you really need, yes, do you? Yes, we do Roger Killer. Now, you see, we have said that above whatever I've written is not normal, but you see, there is something called hypertensive crisis. Anything above 145, and the diastolic is 100. and 5. It means hypertensive crisis. Benjamin, from a lot of working of my body really needs salt, causing leg cramping. No, leg cramping is caused by Caron White. Leg cramping is caused by something called lactic acidosis. We will know about it one day. Lactic acidosis. It's not about salt. Caron, me too don't have any. We have some pain. They ask you have blood pressure. I said no. They checked and they said it's very high. How you say you don't? Pain can make you to have high blood pressure. During small, pain can make you to have high blood pressure because when it is, we will see the mechanism that one is coming. So it when the pain has been treated, the blood it doesn't mean you are hypertensive. It means you are suffering. It is a symptom of the problem that you are suffering at that time. So don't worry, we will know how pain causes high blood pressure. Now we have talked about that. Now stress related high blood pressure. It's okay, Roger Killer. When you are in Nairobi, just call me. We will organize. We will organize and you'll be given a good price. Now, we talk about how stress leads to hypertension. People that get stressed and they lead to getting hypertension. Hmm? Stress affects your body in multiple ways, you know. I went to a friend who is a doctor and he said, I don't have the pain, send it high. Yes, 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 Doreen. That doctor who's your friend was right. Yes. Stress affects your body in multiple ways and significantly impact is it is potential to contribute to the developing of hypertension. Here is the breakdown is this how stress. We have seen about the sympathetic nervous system. So when we are undergoing a particular kind of depression and stress, what is released when you stress, your body activates the sympathetic nervous system, and adrenaline is released, and noradrenaline. Adrenaline, you remember, is the hormone of fight and fright. It is released when you are in danger. But now it is also released when you are having a stressful event, a chronic event. So release of adrenaline and noradrenaline when you are stressed is normal. So what does it do? Sometimes when you are worried, your heart rate rises. It increases, adrenaline increases your heart rate. So that what can happen, it increases your heart rate so that your brain can get enough nutrients and oxygen faster for you to think faster and do some things. You get it? And then I've talked about sympathetic nervous system. The second one is blood vessel constriction so that they can be small for blood to pass. You see, these are mechanisms that we all know. When fluid is passing through this small vessel, it will the fluid is of a particular amount. It will be faster than a fluid that is passing through the bigger vessel. So constriction means small blood vessels, and relaxation it means bigger blood vessels. So what does it mean? It means when your blood is constricted, it will go to the brain so fast. And when your blood is when it is relaxed, what will happen? It will be big. So constriction of the blood vessels is whereby it will do what? It will come out and say, give your brain enough oxygen and nutrients. We want to fight, we want to run, I want to think. You know, by thinking, you are using energy and calories in your brain. So we continue. This can temporarily increase your blood vessels, your blood pressure. So people don't worry about it. Don't worry about sometimes when your blood pressures are high and you have just been running, worried, or doing some things. But now get worried when you have gone to a doctor and your blood pressure is at hypertensive crisis, above 145 over 100. It should be checked and you should be on drugs to reduce it. Then you continue for 5 days on checkup. If it doesn't go down, you continue with drugs. Now, chronic stress keeps this system activated. Sympathetic nervous system. When you are stressed, you are releasing sodium always, sodium, adrenaline always. You see, that is the first way. And then there is the second one, activation of hypothalamic pituitary adrenal axis. Release of the stress hormone. The stress also triggers this axis, the cortisol, stress hormone. When you are stressed, you release this steroid. This is a steroid. It is called cortisol in the hypothalamic region. The pituitary gland is involved in your brain. So, what does this stress hormone called cortisol do? This steroid called cortisol. Sodium and water retention, just as angiotensin 2 does to release the aldosterone. Just as the aldosterone do, it retains sodium and water, and it increases blood volume, because when sodium is inside the blood vessels, water comes in, fluids get in the blood, and it increases blood volume, enhances response to catecholamines like adrenaline. So when this axis is, there is this axis, it is called activation of hypothalamic pituitary adrenaline axis is released. Adrenaline comes in, and you know the work of adrenaline. Adrenaline is fight and fright, run or fight. That is a hormone that gives you energy to fight or fight, and you've seen how it will give you energy by giving your head more oxygen. You get it? And then possible damage to blood over time. If you release this hormone continues for being released, because now you have stress, what will happen? Your blood vessels will damage, will not be okay. Persistent elevation of blood pressure will continue, because now your blood pressures are high, and vasoendothelin, the vasodilator, is not coming out. The nitric oxide, the damaged blood vessels cannot release nitric oxide to dilate the veins. Even if it is released, they are not dilating, they are damaged by scarring. You get it? These are the contributing factors when it comes to stress and my people. You see how things are related. Just imagine how things are related. That's why there are sometimes when you go to a doctor, like when you come to my office and then I look at you and I see you are worried, I usually tell you just walk around, go out, go around. When you are okay, come and take the blood pressure again, or call a nurse, let the nurse do it. You get it? It's very important. Possible damage to blood vessels and walls over time. Very important. When you are releasing this cortisol hormone every time, when you are releasing it, it's not okay. Stress hormone, cortisol hormone, releasing adrenaline, sympathetic nervous system is activated. You are always releasing adrenaline, and your blood water retention and sodium retention in your blood is there. You get it? So you continuously have high blood pressures. And then there is some things now. I'm stressed. What should I do to cover up my stress? What should I do to forget whatever I'm going through? Overeating. Overeating, I've said about overeating. People eat a lot when they are stressed because the brain needs more energy and calories. especially salt and fatty foods, causing cholesterol buildup in your body. And then cholesterol buildup, it does what? Makes your blood vessels to thin because of the sedimentation. You are eating a lot of cholesterols in your body, and then someone is calling me always two missed calls. Just a minute, let me tell them I'll call them some other time. I finish this. Yes. Hmm? You see, now these are things that we look at, and then we see that we should work on them. We should work on them, like overeating. Eh, Nitakupigia, ngoja nimalize nini. Now, yes, like, sorry about that. Sorry about that. Sorry about that. Now, we have talked about overeating, physical activity. When you go to the gym and you want to show everyone that you are the one who knows how to carry the weight, always. You are the one who knows how to work out than everyone. Your blood pressures goes high. Smoking. How does smoking cause? We always associate smoking with everything. Hmm? We always associate smoking with cancer. We always associate smoking with some things. Hmm? You see, nicotine effect. Smoking, I can't even tell the food with sodium or vitamin. Iroja killer. You can't tell any food with sodium or vitamin and you put salt in your food. That food salt is sodium. Hmm? Vitamin is in the vegetables. Eh? Now, nicotine effects stimulate the sympathetic nervous system. So when you have nicotine in your body, when you have nicotine destroying your lungs while you are giving yourself nicotine, and then it is stimulating sympathetic nervous system. The sympathetic nervous system is involved in vasoconstriction, increasing heart rate and cardiac output, and then in the other way, it is increasing insulin resistance. You see how much smoking is a bad thing. Now, insulin resistance again comes to pituitary hypothalamic adrenal problem. Aldosterone is released, retains sodium and water. You get it? Leads to transient increase in blood pressure. Always. And then endothelial problems, dysfunction, like smoking damages the endothelium. Smoking damages the endothelium, lining of the blood vessels, reducing nitric oxide production, which is a vasodilation. Vasodilation. Just imagine. And then we have promotes stiffness of arteries. Your arteries become stiff. They cannot relax or dilate. They cannot constrict or dilate. You see? And then oxidative stress inflammation. Oxidative stress inflammation. Tobacco smoke contains free radicals. And remember, I talked about free radicals when it comes to cancer. Now we are meeting free radicals again. Increase oxidative states and promotes vascular inflammation, just like in cancer. You feel nice, but bringing in all these things contributes to arterial stiffness and atherosclerosis. Atherosclerosis is the stiff of arteries. You see, your arteries and veins should be flexible to relax, to constrict. You are working and flight. You have flight hormone like adrenaline. It should constrict. When you are relaxed, it relaxes. But now you are on the stick. And then what happens? They become stiff. Nicotine increases sympathetic nervous system. You get it? Smoking. These are the problems of smoking now. Endothelial dysfunction. nicotine effect, narrowing blood vessels, increase heart rate, leads to transient increase in blood pressure. And then there is that thing we call renin, angiotensin, and aldosterone system comes in. What happens? So when you are a smoker and you have high blood pressure, don't ask why. Today you know why your pressures are high. We continue, my people. I think I'm left with some. I've left. I've left with some other things. Please ask your questions as we go on, because after this we will know how to treat hypertension. Because have you ever gone to to a doctor? You are given some drugs, of you are told those drugs are for hypertension. You take them, and they are not working. Maybe you are given a wrong drug, or maybe the problem that is bringing hypertension is not solved. Because when you solve that problem, what will happen? You will be okay. Understand me right? We continue. We are on smoking. This is in behavioral and lifestyle effects of stress. We have said overeating, physical activity, smoking, excessive alcohol consumption. Eh? Alcohol consumption. People love alcohol. They call it a social drink. But most of the people that are hyper alcoholics, they are hypertensive. Why? Hmm? Tell me why. Tell me why. You know what alcohol does to your body? Alcohol consumption has a dose dependent relationship. Why? Because when you take alcohol, there is an enzyme in your liver that converts it to water and something else. You get it? So if you take a lot of alcohol exceeding that level that is required, now it becomes poison. You see how alcohol affects blood pressure. You see, it activates again the sympathetic nervous system, increasing heart rate and vasoconstriction with raise in blood pressure. You see, everywhere we are going, sympathetic nervous system is activated. Because now you've taken a lot of alcohol, the enzyme that is in the liver that is supposed to work to that alcohol to break it down to water and some molecules is not enough, and you have taken a lot of, you see. So what happens? Sympathetic nervous system is excited, it start working. You have seen the how it works. Vascular effects, just like smoking, causes arterial stiffness and impairs the endothelial function. When your endothelial function, we have talked about endothelium. Endothelium is inside the blood vessels, which produces nitric oxide. If nitric oxide is not released well, what happens? The vessel cannot relax, so they become stiff, and it disrupts RAS, renin angiotensin system. I've talked about how renin angiotensin system works. And then you will have weight gain and poor sleep. Alcohol is a calorie dense. It has a lot of calories. Hmm? You get it? These are things that we do. Hmm? And we don't think. We take a lot of alcohol, we don't think. We talk a lot of calories and we don't think. Poor sleep patterns. Alcohol brings poor sleep patterns. Hmm? And then we go to the fourth one, inflammation of endothelial dysfunction. We have talked about it, about nitric oxide, which is a vasorelaxer, and the other one, which is a vasoconstrictor, vasoendothelin. Hmm? You get it? Increased blood viscosity and clot risk. Now, here is where there is a problem. Clot risk. Chronic stress can cause blood thickness because some hormones and some factors that are supposed to work. Like your blood has some factors that help you. Hmm? You see, like anti-hemophilia, thrombin. Those are factors that help your blood not to. They control the blood clotting, and when you are cut, they help that place to clog so that you cannot bleed. So when you don't have these factors, hmm, the heparin factor, my friend, because of alcohol intake, what happens? You become with thick blood. Thickness of blood is a problem because now making it hard for your heart to pump blood. This elevates your blood pressure, and that when you go and do a chest X-ray, they tell you have a boot-shaped heart. Hmm? You see that? I've talked about many things today, and at least, sorry, Karen White, about that. Sorry about what happened to your mom. I can't even tell the food with. Sorry. Uh, Benjamin, my mom died from heart disease. She used to worry a lot. Yes, Karen White, when you are worrying a lot, it activates the sympathetic nervous system, and you've seen whatever happened. So we let's just live a normal life. Let's not worry a lot. May her rest in peace. You know she's well wherever she is. True, Doreen, I don't indulge in can. Roger Killer, I can go without sugar but salt. Smoking, my husband just got a heart attack, was hospitalized, just gone for echo results. He wasn't listening. He said something had to take out, but now he stopped smoking. Yes. You see, these are effects that people are trying to say. And my people, please, let's not just let's not stop sharing this information. Share my videos. Let's have a lot of followers. Let people listen to what we are talking about. Share these videos to your friends, to everywhere. Let's save the universe. Hmm? Because some people lack information, and lack of information is what makes people go to attacks. You see, there are some people who don't know what they are undergoing. So I've talked about hypertension today, and that I've explained how hypertension can come about. So if you have any question, I think it's almost 2 hours. If you have any question, please ask as we wind up our topic today, which is hypertension and stress disorders. But you see, we cannot just talk about hypertension and we don't know how to manage it. So tomorrow we will talk about how to manage this hypertension. Hmm? I'm here listening, having a sudden headache. Please take time out, walk a bit, get the fresh air, then you can continue, Marcia. We are about to finish. Sorry about that. Sorry to the at Doreen's mall. Wish him a speed recovery. Sorry about it. Sorry about it. I know doctors are tried their best. Now we try. What I'm usually saying is, you see, some people go to hospital, doctors do whatever they do, and they don't tell you what you are having. They tell you go and take this drug, they'll help you. It is very important to know which drugs to use when you're having a certain condition, because you may take some drugs for hypertension and they are not working. Please, let's not be like that. Tomorrow we are going to finish this. Today we have talked about hypertension. We have discussed about pressure, what is hypertension, and how hypertension comes in, even when we are stressed. So tomorrow we are going to talk about management. Management. And I know many people will have their experiences. Like today, I've seen how people are reacting. You see, these are issues that are, if you are commenting like this, what if we share this video to a lot of people? People will appreciate and you will save the universe. So, thank you so much for having everyone in this platform. Tomorrow, come with questions with a friend. Tell your friend come to the platform. Let's share tomorrow how to take care of people with hypertension. And if a person can be treated to get away from drugs, let's help. Let's help this person so that this person cannot stay in drugs forever and this can be treated. You understand? So have a lovely noon, evening, wherever you are. Here it's 6:18:16. It is 6. Everyone, let's meet tomorrow's meeting topic of management of hypertensive disorders. And please tell your friend to come on board and listen, because I know everywhere someone should be having or knowing a person who has undergone hypertension or a person who is taking drugs for hypertension. Please come with that person tomorrow. My normal hours are 16:30 East African time, 4:30 in the evening East African time. Be blessed. If you have a particular question that you really need to ask me, pin it to my email address. I know everyone has it. I will assist everyone to my capacity. And I usually say my assistant is Neil. I don't charge. I'll advise you accordingly. Mhm. Very nice. Thank everyone. Goodbye. Remember, love is my religion. Be good, stay fresh. Thank you.